Welcome to the ACE-IT podcast, where we turn science into sense. This is our 12th season of ACE-IT, and we're brought to you via the Justice Community Overdose Innovation Network, or JCOIN. I would like to celebrate a bit this season, for as we start season 12, we've reached 21,000 downloads and counting. Woohoo! Yeah, not because we're famous, certainly not, but because that means at least 21,000 times our listeners have learned something about overdose, opioids, opioid use disorder, medication-assisted treatment, and/or harm reduction. And that, my friends, warms my very grateful heart. Also, just a quick plug for a few other JCOIN features that you might not know about. Did you know you can get technical assistance for your organization from the experts at JCOIN for free? And did you know you can apply for small research grants to help fund innovative study ideas? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator to improve your own skills? Also through JCOIN. If you didn't know about these things, check out our website, JCOIN-CTC.org, and learn about the many JCOIN offerings beyond ACE-IT that may help you learn and grow in ways that improve lives. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACE-IT. Okay, welcome back to season 12. We're almost at the last episode. This is season 9 of the ACE-IT podcast, when we're talking about roles, responsibilities, and reactions to overdose. This time, like every episode this season, we're examining how people in different environments and roles prevent and/or react to overdoses. Of course, overdosing can be scary, not only for those experiencing the immediate effects of it, but also for those who are direct witnesses to it. In this episode, we'll talk more about how witnesses and bystanders address or perceive overdoses in the community. And we'll discuss some of the mechanisms used by others to help guide bystanders through the potentially life-saving process of addressing an overdose. While most life-saving is done by professionals, we, as a community, as bystanders and witnesses, may encounter instances which require us to act efficiently and effectively in order to protect someone else. However, the reality is that most witnesses and bystanders don't know how to react and likely have fears about stepping in to help. In a study conducted by Febres Cordero and colleagues in 2024, they dug into what makes people hesitate when they witness an overdose, and a big theme was fear. Many participants were nervous about jumping in to help because they were worried about possible negative consequences, especially at the risk of disease transmission. This fear was strongest when it came to things like needles, which are heavily stigmatized. Despite these concerns, though, participants in the study said that they would still be willing to do rescue breathing if it meant saving someone's life. And while that willingness is incredibly powerful, it's also important to know that life-saving measures don't always have to involve something like mouth-to-mouth resuscitation. Tools like naloxone can reverse an overdose quickly and effectively without the need for direct contact, like rescue breathing. That's why education and access are so important. In a study done by Courtney and colleagues in 2023, researchers explored how everyday people feel about naloxone and what might be holding them back. Even though the states in the study had laws that allowed pharmacists to give out naloxone without a prescription, many people still faced barriers. The biggest issues were lack of knowledge or training, concerns about costs, legal consequences, stigma, and safety worries. Only 16% of participants had received any prior training on naloxone, and those who had training were noticeably more confident and more informed. These findings line up with what we've seen in other programs in the U.S. For example, Bennett and colleagues 2018 looked at an overdose prevention effort in Pennsylvania after the state passed Act 139, which allowed naloxone to be given out without a prescription. This change had a big impact. Suddenly, it wasn't people who used opioids getting trained. Bystanders, family members, peers, and community workers were stepping up to get prepared. In 2014, the program trained 157 new people. Just a year later, that number skyrocketed to 864. The message is clear. When people know naloxone is available and feel confident using it, they're much more likely to get involved and potentially save a life. That kind of impact isn't limited to individuals either. There's a growing recognition that businesses, especially in areas heavily affected by drug use, can be an important part of the response too. One study by Schneider 2022 focused on businesses in high drug use neighborhoods in Baltimore and found that nearly 2/3 of employees had seen an overdose happen at work within just 6 months. Despite that, most businesses didn't keep naloxone on site and had very few staff trained to use it. This highlights a gap in outreach. Businesses often aren't included in naloxone distribution efforts, even though they clearly encounter overdoses. The author suggests that targeting workplaces with training and access to naloxone could be a powerful way to expand community safety. They even suggest small steps like window signs that could let people know where they can find help if an overdose is nearby. New technology has opened up even more ways for communities to respond. One study conducted by Schwartz and colleagues in 2020 tested out a smartphone app that let trained volunteers, both people who used opioids and community members, signal when they saw a suspected overdose. The app didn't just alert other nearby volunteers, it also contacted emergency services automatically. Out of 291 alerts sent, about 200 were real overdose situations, and naloxone was used in 74 of them. What's powerful is that in nearly 60% of those cases, naloxone was given at least 5 minutes before EMS arrived, buying critical time that likely saved lives. In the majority of these cases, the person who sent the alert was also the one who gave the naloxone, and 96% of the people who received it survived. That's huge. When you put all these pieces together, education, access, supportive policy, workplace readiness, and now even real-time tools like apps, witnesses and bystanders can and do save lives. The barriers are real, but so is the opportunity. Whether it's someone you know, a passerby on the street, an employee at work, bystanders are often the first and sometimes the only chance someone has at surviving an overdose. The more we support and equip people with the right tools, the more prepared we are to protect each other when it matters the most. Thank you for listening to the ACE-IT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes, D-R-U-D-E-S, @shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters and also my fantastic doctoral students, Bryce Kushmerek-McCune and Jalen Magana. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Remember to check out our website, JCOIN-CTC.org, for more cool JCOIN features and opportunities. And tune in again soon for another episode of ACE-IT.